demonstrating how to use a pulse oximeter. The primary goal of this procedure is for the patient to exhibit an arterial blood gas oxygen saturation within the acceptable parameters or greater than 95%.
For the equipment, we need to check for the oximeter, and the oximeter probe should be appropriate for the patient and recommended by the oximeter manufacturer. Acetone or nail polish remover if needed, because if our client is wearing any nail polish, especially if it is dark colored, it may interfere with the readings because it can block the light and sensor of the oximeter. Then, for the documentation, we need to have the pen and a vital sign flow sheet or the electronic health record, whichever our hospital uses. Then, we need to have alcohol and cotton balls to clean the oximeter device, as well as for hand hygiene and on cleaning our client's finger.
For the implementation, first we need to review our patient's chart for any health problems that may affect their oxygenation status. This will give us an idea if their condition is improving or if it is deteriorating. Examples of health conditions that may affect their oxygen status include any heart and lung problems, or if they have any condition which requires them to take a vasoconstrictive medicine. Now, we need to bring the necessary equipment to the bedside table or the overbed table for better access during the procedure and to save time. Perform hand hygiene and put on your personal protective equipment if needed. Then, identify the patient by simply asking his or her name and by comparing it to their identification wristband. Good day, ma'am. I am Hanz Nicole from the UST and I will be your student nurse for today. May I know your name, ma'am?
Juni Cyrus,
And your date of birth?
December 1, 2020.
Then, close the curtains around the bed and close the door to the room if possible. This will help us to provide privacy. Explain to the client what you're going to do and why it is necessary to lessen their anxiety and promote their cooperation. So now I will be doing a procedure which requires me to use this device called the pulse oximeter. I will be placing this device in between your index finger to measure the level of oxygen in your body. This will help us to see if your condition is improving. And now this procedure is painless and will only take about a minute. Select an adequate site for the application of the sensor. We can use the client's index, middle, or ring finger, but we need to check the proximal pulse and the capillary refill at the pulse closest to the site. This is to check if their circulation is good, because if not, it may also interfere with the accuracy of the reading. That is why if the circulation at the site is inadequate, consider using the earlobe, the forehead, or the bridge of the nose instead. And we can also use the toe only if the circulation on the lower extremities is not compromised. So now, ma'am, I will proceed in checking your pulse. Okay, your pulse rate is 77 beats per minute, which is within the normal range. And I will also check your capillary refill. And it is also good. This means that we can proceed in using your index finger. Select the proper equipment. If one finger is too large for the probe, use a smaller one, and use probes appropriate for the patient's age and size to ensure the fitting and accuracy. And check if the patient is allergic to adhesive, since some device will require us to use an adhesive tape to secure the probe and prevent it from falling. Then prepare the monitoring site by cleansing the selected area with an alcohol wipe or disposable cleansing cloth. Then allow the area to dry, and if possible, we should remove the nail polish or any artificial nails that may impair the accuracy of the reading. So now I will proceed in cleaning your index finger. And also clean the pulse oximeter device. Okay, ma'am, can you point out your index finger for me? Now, I will apply the probe securely to the skin, making sure that the light emitting sensor and the light receiving sensor are aligned opposite each other, with the light emitting diode on top and the light receiving sensor below the fingertip. And connect the sensor probe to the pulse oximeter. But since we're using a cordless oximeter, what we will do is just place the oximeter in between the fingertip. And turn the oximeter on by clicking a button. And check the operation of the equipment. Then check the oxygen saturation at regular intervals as ordered by the primary care provider, the nursing assessment, and signaled by alarms. Remove the sensor on a regular basis. And check for skin irritation or signs of pressure every 2 hours for spring tension sensor or every 4 hours for adhesive finger or toe sensor. Then, clean the non-disposable sensors according to the manufacturer's direction. Then, remove your PPE if used and perform hand hygiene. Okay, ma'am, your rating is 98%, which means that your oxygen in your body is good. And thank you for cooperating the procedure. Document the procedure done as well as the reading. If the reading is abnormal, we should notify the primary care provider immediately.